if they don't take shower daily, if you are wearing the sweaty clothes or moist retained clothes for a long time, the safety shoes. We get lots of patients wearing safety shoes for a long time. The thing is, all round patches or all itchy lesions are not fungal. If one child is infected, when they share the common materials by touching and all, the other kids are also more prone to get that sort of infection. You need to get a proper advice from the dermatologist. The concentration and all will be advised properly from the doctor.
Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al-HILAL Health World, nothing but lifestyle, a talk show with the expert doctors of Al-HILAL hospitals and medical centers. Today we will be discussing about a subject that affects people of all ages and skin types, skin infections. And the doctor joining us today is Dr. Rashma Thomas, the specialist dermatologist from Al-HILAL Hospital, Hidde branch. So Doctor, welcome to the show.
Thank you.
You're welcome, Doctor. Doctor, what are the common skin infections you come across in your clinic these days?
Yeah, we see more of fungal, bacterial, viral infections and all. We'll be more describing fungal and bacterial infections in this topic because the whole topic will be a bit wide. Okay, so regarding the common fungal infections, we see like lot of fungal infection which appear as just like white patches or dark patches with mild scaling, mainly over the sweaty areas of the body. There may not be any itching associated with that, and some people they complain of itching when they sweat a lot. These are the most common fungal infection. It's called pityriasis versicolor, and there is yet another more common, everyone is more familiar with. It's called ringworm. It appears as red round patches with a bit of scaling at the periphery. That is, the borders show more activity, more scaling. That's called ringworm. So it can occur on any part of the body, and the name changes depending on the site of the fungal infection. If it occurs on the legs, it's called athlete's foot. If it occurs on the groin area, like inner thigh area, it is called jock itch. It can occur even over the exposed parts, over the forearm, or the legs. Those who have pets and all, they get fungal infections mainly over the exposed parts of the body. It can even occur on the scalp. It can affect the hair. It's called tinea capitis, it is different. It can even affect the fingernails or toenails. Toenails are more affected than the fingernails. So these are like different forms of the fungal infection. And we can also get acne form. Acne means pimple-like lesions even with the fungus.
Doctor, what are the everyday habits that increase the risk of skin infections?
The fungus, it loves to thrive in moist, humid environment. Okay, so those who sweat a lot, they can have more chance for fungal infection, and those who are obese, because the skin folds will be a bit tight, the fungus can easily harbor in those sites. And those who are diabetic or immunocompromised, though they are also more prone for the fungal infection. And the everyday habits include those who doesn't maintain a good hygiene practices, like if they don't take shower daily, if you are wearing the sweaty clothes or moist retained clothes for a long time, if you are wearing the socks or a bit tight shoes for a long time, especially like the safety shoes. We get lots of patients wearing safety shoes for a long time. So they are also more prone for the fungal infection. Also, like those who share their personal items, like even sharing of clothes, okay, sharing of comb, the brush, okay, and even sharing of the bed sheets or the footwear, they are also prone for fungal infections. Those who walk barefoot in the public places, maybe like in gym and all, those who walk barefoot, they can also get. And in these days, like those who travel a lot, so they may not be able to change clothes, they may not be able to change undergarments and all 2 times daily. So they can also get fungal infection. And in case of kids, children, they get fungal infections more over scalp, okay, because they may be sharing their things together in the school and all. more of skin to skin contact will be there more with the kids because they may be playing together. So one kid is affected, there is every chance for getting the infections to other kids also. So yeah, these are the habits that we should avoid to prevent the fungal infection.
Then how do dermatologists confirm that skin infection is fungal?
Yeah, the fungal the thing is all round patches or all itchy lesions are not fungal. Okay, so sometimes even those who have like eczema or psoriasis, it can also have the same presentation as that of the fungal. And these days the main problem is the patients, they might be using many of the OTC creams containing steroids like cortisone, steroid creams. They may be using these sort of creams for a long time from outside. So when we use a steroid, the thing is the initial presentation will be a bit changed, it will be completely altered. So it will be a bit confusing to find whether it is a fungal or whether it is any other skin condition. So in that case and all, we may have to go for further test. Okay, so yeah, that's it.
Another common query is, can these fungi become resistant to medications?
Yeah, that's a very good question. Fungal resistance also can occur, as I told, like when we take antibiotics for long term. The other thing is when the antifungal tablets itself are not taken as per the prescription, that is, if the patient is taking a short course of antifungal tablet, or rather than 2 times daily, sometimes they may take 1 time daily. That sort of low dose antifungal treatment itself can cause the fungus to grow more strength and more active. And this fungal resistance, that means the fungus itself is changing or it is having its own mutations, so that the normal antifungals that is provided, it's not working, it's not able to kill that sort of fungus.
Doctor, now can you explain about the current first line treatment for fungal infection?
Yeah, if a single patch, okay, and it's recently detected by the patient, topical creams will be enough. And in case for children also, and in pregnant ladies, we can start with topicals if it is not extensive, if it is a single patch, we can start with the topical creams and all. But in those who are diabetic, immunocompromised, or those who have multiple patches in the body, it's better to go with the oral antifungal tablets itself.
Doctor, how long does the treatment take and why is consistency so important?
Yeah, usually the treatment for fungal infection is a bit more prolonged. Okay, so that is with concern for the patient. But the problem is fungus is something that can remain dead in the skin for a long time. So again, when the favorable climate comes again, it can reactivate itself. Also, the fungus has itself like a strong cell wall. It produces a strong biofilling around. So the antifungals are not able to easily penetrate into the fungus and kill the fungus. And the other thing is it has fungal spores. So the spores can remain in the bed sheet or in the materials at which you are using. It can remain dead like for 40 days and all. Okay. So all this cause the fungal infections to be treated for a bit more time than the bacterial infection. So usually the more prolonged treatment will be needed for the fungal infection of the hair and fungal infection of the nail. Okay, so for hair we may need treatment for 6 to 8 weeks. Okay, and for the nail, again, for the toenail we may need treatment for 12 to 18 weeks, and for fingernail for 6 to 12 weeks. This is because the growth of the toenail, it's more slow than the fingernail, and we need to completely eradicate the fungus from the nail matrix, that is from where the nail grow to the tip. So a bit more prolonged time we have to continue the treatment. And the other thing is, even after stopping the antifungal treatment, antifungal tablet, one has to continue using the antifungal creams, like even 1 month after the complete clearance or complete disappearance of the lesion, one has to continue 1 month more the topical cream. And even there are, like, we also write shampoos, antifungal shampoos. Okay, so that is a good maintenance. One can continue the antifungal shampoo, use the antifungal shampoo even for 6 months to 1 year, one can continue using the antifungal shampoo. Because of the resistant cases of fungus we are seeing, every measure we should take to reduce the recurrence of the fungal. And the other thing is, when we apply the cream, make sure you are applying over the area and a bit 1 centimeter of the surrounding area also. And every time after application, make sure you are washing the hands with soap and all, and make sure you are trimming the nails. If you have the nail fungus and all, it's good to trim the nails. Yeah, so that will be needed. That.
What happens if someone stops the treatment too early? I mean, if someone stops the medicines too early.
Yeah, that is the point that we discussed earlier. There is something called fungal resistance. So actually the low dose, if you are taking like rather than twice daily dosage, if one thinks I need only once daily dosage, that itself can favor the growth of fungus. The fungus will become more and more strong. And the other cause of fungal resistance we see, like because of the more usage of fungicides in agriculture. So that itself, these all create like more of fungal resistant strain. So in that case, sometimes we may switch to one antifungal class of one antifungal tablet. But if one is resistant, we may switch to another class of antifungal tablet. And sometimes we may have to combine together two antifungal classes together. So the main problem is all this sort of antifungal treatment, if you are planning to continue for 1 month, 2 months and all, it's always good to do liver function and kidney function. Blood monitoring is important. Okay, like for after 1 month, better to do the liver function and kidney function. And usually it is safe, but very rarely one can get a bit raised liver function, but nothing to be worried. After stopping the medicine, everything will be returned back to the normal level. But once you find any variation, any changes in the liver enzymes and all, better to halt the antifungal tablets and all, just continue the topical creams.
Now, can you explain about the fungal acne?
Yeah, fungal acne is something that is a bit confusing. It's actually a misnomer. It's rather than acne, it is an infection of the hair follicle with fungus. Okay, so the problem, the patient may be taking all sort of treatment for acne, may not be finding any relief with the acne treatments, may be applying all the creams for acne, but still if the patient is not getting any relief, then in that case, we need to think about fungal acne. And the presentation itself is big different. Rather than the normal acne, there won't be any comedones like blackheads, whiteheads, that won't be there for fungal acne. It will be main or the sweaty areas of the body or the back or the chest, and it will be a bit itchy also. It is more seen in those who go to gym activities, those who wear tight fitting clothes, okay, those who sweat a lot, those who are not able to change the sweaty clothes and all, they can get fungal acne. And we see also fungal acne in those who take steroids, oral steroid for any other condition. So they can also get fungal acne, or those who are taking oral antibiotic, or bedridden patients, oral antibiotic if they were taking for a bit long time, they can also get fungal acne. So in that case, a treatment will be entirely different rather than acne, normal acne. It won't be better with antibiotic course and all. We need oral antifungal tablet, we need antifungal creams and all. But as a problem, since it is fungus, we need a bit more time, more prolonged treatment time, maybe for 1 month and all, we have to go for antifungal tablets.
Now, doctor, coming to the bacterial infections, what are the common bacterial skin infections you see daily?
Yeah, bacterial infections are also very common. The most common that we see include impetigo, others like folliculitis, then furuncle. If the infection is extensive, can lead to cellulitis, that sort of things and all. So this impetigo, it's very contagious, superficial infection of the skin. It's more seen in small children, infants and all. It's caused by bacteria staph. It's very common. So it appears in the beginning, it appears as red sores over the face, around the mouth, around the nose and all. And for after a few days, it will develop like honey-colored crusting will be there. And it is contagious, as I mentioned, it is contagious. If one child is infected, since when they share the common materials by touching and all, the other kids are also more prone to get that sort of infection. So the treatment will be like, if a single patch or topical antibiotics will be enough. Washing the face with soap and water is also good, recommended. And for multiple patches, if the lesions are extensive, you can go with oral antibiotic tablets. Okay, the other infections include folliculitis. Folliculitis means infection of the hair follicle. More seen over the hairy areas of the body, can occur over the face, or scalp, or underarms, pubic area, or the hairy areas one can get. One can more prone for those who have an impaired skin barrier, eczema or psoriasis, or more common in diabetes, obese patients. It's also common in those who sweat a lot, okay, those who are working in hot, humid climate, and pollution, dust also can increase the cause of folliculitis. And if multiple hair follicles are affected, it is called furuncle in that case. And sometimes if the infection is more, it can lead to cellulitis. That means the infection extending to the deeper layers of the skin. So yeah, these are the common bacterial infection encountered.
And can you speak about the measures to reduce recurrent bacterial infections?
Yeah, the thing is, for some people, especially when it comes to the scalp and all, one can get recurrent scalp folliculitis. Also, some people they say the boils, they are getting recurrent boils over the body. So many causes. One, there is something called bacterial colonization in the skin. For some people, they have more of bacteria colonized in specific areas of the skin, and the areas include inside the nostril, the underarm area, and the pubic area. So these are the areas where there will be more of bacterial colonization. So sometimes with a course of antibiotic, it may not be completely cleared. In that case, we need to properly apply the antibiotic cream over all these areas, like inside the nostrils. So when we say, the patients will be like surprised, why should we apply like inside the nostril? Because these are the areas where one can have more of bacterial colonization. So we advise the patients to apply inside the nostril, underarm area, and pubic area, even though the patient doesn't have any active boils over that area. These all like applicable to those who have recurrent bacterial infection. Also, there is something called bleach bath. You know, like we use bleach, normal bleach. That's to use for the normal routine household bleach, but that is helpful for those with recurrent bacterial infection. But the concentration, it has to be, you need to get a proper advice from the dermatologist. The concentration and all will be advised properly from the doctor. According to that, only use a bleach bath. Otherwise, it will definitely irritate the skin. It can cause dryness and all. Okay, and the other cause will be those who work in sweaty environment, hot, humid climate. Those who are working in polluted environment, dusty environment. One can get this sort of recurrent bacterial infection. So if one gets recurrent infection, it's always advised to go with a pus swab. Okay, so we will be taking the pus and we'll be sending for the culture. So with the culture report, it will be mentioned which type of bacteria is causing, which antibiotic has to be given. Okay, because some of the infections, folliculitis infections, can be acquired from the hospitals, from the healthcare. So in that case, from the folliculitis from the healthcare, it won't be responding to the normal antibiotic that we usually prescribe, like amoxicillin, clavulanic, augmentin, that sort of medicine may not respond. In that case, like separate antibiotics has to be prescribed. So pus culture of recurrent folliculitis become very important. And as I mentioned, to prevent the bacterial colonization, all these methods has to be done. And every type of bacterial and fungal infection, they enter the skin through any abrasions, any scratch in the body. So we need a good protective skin barrier. Okay, so better to avoid scratching. Okay, and use some moisturizing creams and all to have a good skin barrier is also important. And after coming from the public place, like visiting the mall or going from the hospital, touching the door handles of the hospitals and all, it's always good to wash the hands with the soap and water.
And doctor, what is the one key message you want the viewers to keep in mind after this discussion?
Yeah, I would advise the patients not to go with off-label creams, OTC creams, because some of these creams contain cortisone. So you may be telling the pharmacist having pimples or having itching. So they will be prescribing the creams that is meant for itching that contains cortisone. It is helpful for eczema but not for these sort of infections. But so don't go for OTC creams or off-label creams because it will worsen your condition. Definitely get an advice from the dermatologist. If needed, has to take the oral antifungal tablets or oral antibiotic as prescribed by the doctor. It may take like 1 month or 2 months, but you have to complete the dosage according to the prescribed strength, according to the prescribed duration. The tablet has to be taken.
And finally, doctor, what do you have to say about AL-HILAL healthcare service?
Yeah, with regard to the fungal and bacterial, we have all the tests for fungal and bacterial infection. We can give appropriate treatments and all. Along with that, rather than treating the skin infections, we also do a few of cosmetic procedures like PRP. Then we have microneedling, PRP for face, PRP for scalp. We also have MNRF, microneedling with RF for acne scars. We have laser hair removal. We do cryotherapy for viral warts. We do cautery, electrocautery for viral warts. Yeah. And yeah, we have mesotherapy for hair loss. That's it.
Thank you, doctor.
Okay.
Thank you very much.
Thank you. Thank you.
So viewers, that brings us to the end of today's discussion on skin infections. Thank you for watching, and this is Jessila Mujib signing off. Good night.